talagang inalalayan niya tayo
But she
sa...
hasn't changed. She's
Yeah.
still as pretty and as perky as ever.
Of course.
And as nice.
Yeah.
So easy to talk to and relate.
Very bubbly.
Yes. Nasa jeans yan eh.
Sabi ko nga, inalalayan niya tayo, di ba? Doon sa ating
Yes.
pagiging mas presentable sa
Yes.
sa camera and
Oo,
everything.
with our skin.
Sige, do the honors, please.
Yes. We've invited a lot of doctors sa show natin, but she has a special place in our hearts kasi nga 3 years, that's not a short time, di ba? Na we've known each other. Tapos we've also known her family. And sabi mo nga kasi tayo, natural tayo di ba? So she helps us also in our advocacy to maintain our facial skin as naturally youthful as possible. So I'd like to welcome, and it is with pride and giddiness, happiness that I present to you sa Fitness Couple Radio, our friend, top A dermatologist, Dr. KYLA Talents of Skin Philosophy. Hi, Dr. KYLA.
Welcome to the Fitness Couple again. No? For the
Yes.
second time.
Actually, we wanted to invite her even before pa.
Mhm.
Kaya lang, she's so busy kasi
Yes.
ang kanyang clinic is Mondays through Sundays.
Mhm.
Dr. KYLA, how are you?
I'm good. Thank you so much for having me. It's good to be back. And I'm very happy to be here.
What time did you wake up? I know you don't get up early kasi you stay late in the clinic, di ba?
Yes, so I got up at 8 a.m. today. But for you, I'm very happy.
Thank you
Oh,
very
thank
much.
you. And thank you, of course, kay your dad, no?
Yeah.
Mario Talents for driving you. And of course, your mom, my friend, our friend, Grace Talents for accompanying you. It's her first time. But
Yes.
it's your dad's second time. And
yeah.
you've guested already in Taong Bahay
Yeah.
recently,
We
right?
saw that.
Yeah.
Yeah, we watched you.
it.
So, Doctora, what's new with Skin Philosophy and what's new with Doctora KYLA Talents?
Well, as for my personal life, there's nothing new. It's the same old story.
Oh,
I'm just working
kaya
every day.
Really?
meron
Really?
tayong a cam, right? So, kaya lang dapat screen natin yon yung mga, di ba, yung mga would-be suitors or admirers ni Doktora. At ang special screening committee, syempre yung parents.
Dating up na ba tayo?
Why not? Anything goes, di ba? Pang family tayo
Okay,
But,
sige.
Doktora, I can't imagine nga kung bakit Baka she's busy with your work. You're busy with your work. So I think you really need time to
At saka
chill. and-
mapihikan si Doktora kasi.
No.
Ano ba
It's
basic
just
qualifications? I'm sure meron kang parang model dyan. I'm sure it's your dad, right? Because they've been happily married for how many years now?
several years since like a year before I was born. So
Wow!
yeah, that's
Congratulations!
1980.
Kaya nga, napakahirap makahanap ng kagaya ng daddy mo.
Yes, that's
But
true.
on your professional side, what's new with you, Doktora?
Well, we are already offering new services now. So our latest machine is the diamond fractional laser. It's very good for pore tightening, and we also use it to reduce stretch marks. So it's actually
okay.
treatable. Like after giving birth, because of the stretching of the skin, you get stretch marks. If it's still purplish, we have the vascular laser for that. But if they're already white, then we can do either scar repair or we can do fractional laser.
Usually, ang
Parang
stretch,
non-invasive yun.
They
Doktora.
are non-invasive.
Yes.
Yes.
usually, Doktora, di ba, pagka, yun ang problem ng mga babae, normally, yung stretch marks,
Yes.
So this is your latest parang equipment? Or your latest toy?
Yes, my latest toy. So, women and men alike, like when they gain or lose weight, there's damage to the elastin. So, stretch marks often appear, but they're treatable now. But sometimes it requires around 2 to 4 sessions, sometimes 6 if they're pretty deep. So the fractional laser is good for rejuvenation. It's also good for treating superficial scars, but not deep scars.
So, pwede sa face, doktora?
Yes,
To
for
remove-
anti-aging.
Yeah. Sige, mamaya. Kasi, ang very familiar kami dun sa Genesis eh. So, this
Laser
is your
Genesis.
latest para matanggal yung scars sa face?
Well, for
Yung from
scars,
acne or tapos yung signs of aging like wrinkles?
well,
and
the
dark
diamond
spots?
Yes, dark spots. So the diamond fractional laser has several uses. It can reduce dark spots, it can reduce open pores, it's good for superficial wrinkles or fine lines. It's also good for superficial scars. But for deep acne scars, the scar repair is a lot better.
Okay.
Yes.
So, depende sa degree.
Yes.
Oo.
So for scar repair, we use microneedling with RF. There are lots of different microneedling with RF devices out there, but it's actually our clinic protocol that spells the difference, because it's like, for example, two surgeons have exactly the same knife, the same model of knife, but they produce totally different results because they have different techniques. So scar repair refers not to the machine but to our protocol, like how we use microneedling with RF.
Kasi ikaw mismo, doktora, ang gumagawa, right?
Yes, me or my associate doctor. So we use various settings, we use various needle lengths, and like the decision would be based on the type of scarring.
Yeah, so it's the same, it can be the same technology, pero yung methodology. At saka, I
Exactly.
suppose, the expertise, no?
Yes, that's very important, because just like surgery, it's very skill dependent.
Right. At saka maganda sa'yo, doktora, yung mga clients mo, no, hindi mahihiya na magsabi sa'yo. So they can be 100% honest with you. And vice versa.
Hands-on si Doktora.
Kung ano lang yung kailangan, yun lang ang gagawin.
Yes.
Tapos yun naman sa stretch marks, I can relate to that. Having born 3 kids, no? Talagang sobrang hirap. In my case, as you know, I do a lot of yung passionate exercise. Talagang hindi ko tinitigil yun whatever happens. Plus, I eat sensibly na hindi madali. Kaya nahihirapan ang majority ng mga kababaihan na nanganak na or yung mga tumaba, di ba? Kahit lalaki tumaba tapos biglang pumayat, magkakaroon ng stretch marks. So, at least there is an option to remove completely or at least to lighten.
Well, I don't overpromise, but there are cases wherein the stretch marks can totally disappear. But
Okay.
what's important is with a few sessions, at least you're able to like make it blend more with the normal skin.
Halimbawa, parang hindi na masyadong, depende din sa genetics, doktora, no?
Yes, some people are very prone to stretch marks, while
Yes,
some
and
people are
scars
luckier.
and keloids for that matter.
Yes, keloids
Tapos,
especially.
doktor, how about the loose skin? Kasi pag nanganak ka or pumayat ka, yun ang problema nagsasag yung skin. May remedyo ba yun?
Yes, there is.
What is it, doktora?
At Philosophie, we use the Tri-RF machine for skin tightening, and it can also reduce the fat in the area. But it takes about 6 to 8 sessions before you achieve the desired results, and collagen formation kasi takes time. So it takes about 30 to 90 days for new collagen to be produced. So you see the optimal benefits around 3 months after your last treatment.
It takes time, no?
Yes.
In the same manner na it took time na, for you to gain weight. Yung pagbubuntis is, 9 months, di ba? So it also takes time na ma-address yung sagging skin na yon. And you mentioned collagen, doktora. How do you address that? How do you parang ini-induce